Welcome. I get to introduce you to Dr. Serena Goldstein today. She is a colleague of mine, a naturopathic doctor, and we've known each other, I think, even since she was a student in naturopathic medical school and I was practicing, because she's from New York and I live in New York. And so we've known each other for quite a few years. And now she's a practicing naturopathic doctor actually in California. And I'm just really excited to share her wisdom with you because she has a lot of not only experience as a naturopathic doctor, but also as from her own personal health experience, listening to her body, listening to the messages that she's received about navigating her life and her health. And so thank you so much for joining me today, Serena. I'm so glad to have this conversation with you.
Same here. Thank you so much for having me. And so I realized, I think it was from 2010.
Oh, is that when it was?
Yeah. It was with one of our other colleagues I don't remember. It was like one of you was running late and then told me to just, pop into the other one's room. They won't mind.
Preceptoring. You were preceptoring.
Yeah. Yeah. Back in the days when I was preceptoring, you guys. And this is, you had the practice in Long Island. I remember coming out to Connecticut with you too, one of the days, and then also in New York City. So in that blip of when you talked about listening to your body, the other piece that also it helped me realize, it's also listening to that life path. Like, what are the patterns? And the funny thing is, because I am someone where I always admired where you had the writing, the speaking, the supplements, like you're always doing a lot of different things. You are the types of doctors I always gravitated to. So of course it makes sense that I'm also got, like I have a whole press page on my website, but without really realizing it at the time. Yes, we'll talk listening to the body, but there's also listening to the universe of like, who do you gravitate to? So,
and just noticing. Tell us a little more about what brought you to become a naturopathic doctor and to do what you're doing at this point.
Yeah. So I would say the journey started, I could say even way back when, to those early days of 3-4 years old, staring at the sky, wondering about the meaning of life. Like, there's more out there. But, whatever, like fast forward grade school, I was a competitive gymnast, played the trombone, all those accomplishments. And then sophomore year of high school, I injured my elbow in gymnastics. And that meant no gymnastics, no trombone. And I sank into this depression. But that wasn't me at the core. I was like, wait, I don't want to feel like this. So I go to the library and I start reading young Erickson and Freud to figure out what was going on.
Look at you. Wow. You're just like, let me figure this out.
Exactly. And it's that same MO that I realized, wait, I've always had. Because from there, it was when I got bogged down with information that I was like, I think I need help. There were a few more injuries and other things that year. But when I came into my junior year, I wound up finding a therapist who I loved. And she was a PhD in psychology. So I was like, I want to give back the same healing that she gave to me. And that started my journey as a healer. There aren't any medical people in my family. So it was just that place of, I don't know, I thought of being an entrepreneur because my dad was, and he was really happy. So, okay, this seems legit. Like, why not? And so I go to college and I started as a psychology major and then a Japanese minor because I finished with 3 honors when I was in Japanese. And you can hear my cat giving a testimony.
That's the cat making this.
Yes. He's very...
This is so interesting because I think that a lot of people don't realize that naturopathic medicine involves a lot of psychology. And I think where you're going with your story is you started from a psychology interest and major, and you ended up going into naturopathic medicine and now really integrating psychology into your practice, which is, I like to really point that out because a lot of times as naturopathic doctors, we end up focusing on the diet and the nutrients and the herbs and all the amazing things we can do. But we also have additional training in psychology and counseling people about not only their health, but their health issues. And I think that's a really important aspect that sometimes even with me practicing for over 21 years, sometimes my patients aren't aware that I have that in my skills, in my toolbox, so to speak.
Yeah.
Wow.
And so you just brought up such an interesting point, because that was exactly what drew me to naturopathic medicine. Because when Japanese didn't work out, a friend said, well, why don't you go pre-med? You could do more for people. So that's why I referenced that little girl. I was like, oh, there's more in the world. There's more out there. And conventional schools seem too rigid. And then a month later, the teacher in the learning community took us to the naturopathic school. And you're right. It was like, wait, I learned conventional, natural medicine, and I get to use all my psychology. To the point that what you were saying too was a lot of my journey was with weight and hormones and the roller coaster of weight loss and weight gain in the last few pounds, and then feeling like I have to be perfect if I'm going to preach, because I just had to, because you're the doctor, you're supposed to fix yourself and know everything and look a certain way, when really life is just about the journey and it's our big self-expression. So when I too had the patients with well, why can't we lose the last few pounds? Why are we doing cleanses and still nothing is sticking? That means I had to go back within myself and say, wait a second, this is not just the course or two of psychology, because we did, a little bit of course in medical school, but the truth is this wasn't even in my degree, a lot of it. This was going deeper, because we're also asking people to break habits. So where do habits come from? Okay, from growing up. Who did we grow up around? Society, our parents. Okay, let's talk these words called generational trauma and karma. What about who we were in our past lives? Like there's all this that's also locked in this intuition.
A lot. It
covered through all the stuff that we've been told, that it was like, it's now this psychology. Then of course you could add in boundaries and speaking up for yourself and all of that. That's now going beyond, I feel so much of what I was even taught in my degree. But you're getting to that deep soul wisdom and the intuition.
Yeah. And what you're saying is that it's like we might be searching for answers on a physical level, whether it's say from a physical injury, and you think, oh, it's just because of the injury that I have this pain. But when you really look into it, there's much more meaning underneath that we often might miss or dismiss just because we think, oh, that just happened as an accident. But why were you, then you start to ask, well, why were you doing the gymnastics to begin with and pushing yourself hard and leading yourself to be susceptible to the injury, right? Or other health issues, like you mentioned, weight gain. And a lot of people do struggle with body image and the way their body looks to them. And it's often, it's not just about restricting your diet and exercising, right? It's about, hey, let me really understand what my body is trying to say to me and what my past stress, exposure, and life experience why has it led to this point of my body showing up in this way? And it takes courage, I think, to be willing to look at these things, right?
Oh my God. It's so funny you say that too, because it's like the breakdowns are just as important as the breakthroughs. But it's also surrendering that there's no final point. Because it's funny, like I've had people say to me too, well, I don't want to get too thin, but maybe if I could just look like this, or like there's still that bit of control. And ironically, the universe doesn't understand that.
It doesn't even exist there.
Yeah, it doesn't understand negative. So actually, you're probably stopping yourself at this point. But okay, we'll do a little work around that, bring a lot into awareness, create the safe space and so forth. So yeah, it doesn't understand negatives, and the change from within, like that alignment, then it means whatever decision you make comes out of alignment. It's
Mhm.
less cerebral. It's as, oh my God, that was it too. How many food plans would I give patients and no one would do their homework? So then I'm like, wait, I'm going to lose my whole practice if I start belittling people, But I mean, that's not really who I am
We know it's
anyway.
not going to work. Yeah,
No,
it's
it
not.
was
But
like,
that does happen
why?
sometimes for people in the medical community. They get judged or they judge themselves for not following a certain, diet or caloric restrictions, and then it just perpetuates the negative self-talk, right? And then the negative just perpetuates the health issues. And we can see that because we see the patterns with working with so many patients. We go, oh, I see that same pattern again, where it's just a certain, if there's conditionality even in the treatment plan, it's going to work against the person. We have to find a way to be this unconditional support and show them how to be unconditional support for themselves. And that's where that's where they can find some of this. I love how you're pointing at what I think of as quantum physics too. I think, and I'm excited because this is not something I get to talk about very often. And if anyone listening hasn't read or gone into learning about quantum physics before, I definitely encourage you to learn more about it and understanding what we know beyond kind of like standard physics and standard understanding of ourselves and our universe, and to be able to realize that a lot of things we as humans have kind of create as constructs, even just the construct of time, right? Like, what time is it? How long does this take? What time is something supposed to happen? How long is it supposed to take? These are all things that they're basically like illusions that we create to try to understand our world and the world around us. But really, in a quantum physics level, which is very energetic and expansive, there's no time. And so you can find yourself, the more and more you can become aware of it, then you can find yourself looking at things differently, because you realize, oh, there's certain things that we just created as almost an illusion to try to make ourselves feel better, but it actually doesn't help us feel better, because it takes us further from the truth of energetic beings in an energetic universe interacting with each other and understanding ourselves and each other better.
Yeah. Yeah. To all of that. And also too, and it's funny because you also made me flash back to when I was taking physics as, like a pre-med prerequisite. And I was like, yeah, there was no talk of any of this, like in that physics class. But yet a lot of what I share too is, before things materialize into the physical form, we have our mental body, like there's, different auric fields, because we really are energy in this 3D form, which is very dense. But we have, this mental emotional field, this etheric, so like even more energy kind of coming around us. And then the auric and the astral. So it's like, this is where certain dream states, take place, or even dreams could be clues to like, wait, what do we need to do next? What is the next issue to take care of? So there's all these different energy states that, so if we can change some of them on the day to day, which is our mental, emotional, even if we have to sit with our stuff too for a bit, because I think that's important to give people permission.
Once we realize how often we essentially distract ourselves, right? We're distracted with having to work and having to, say, be a parent, or even take care of our animals and take care of task lists and emails and voicemails. And right, these are just distracting us from really being able to just be in the moment, be with ourselves. And that's sometimes why we miss that information. In some ways, I think we want to distract ourselves from the information. Sometimes we think we don't want to know. And so we stay busy in order to avoid that. I mean, I know that happened to me also. I mean, I have I also, by the way, was a gymnast for a lot of my childhood
Wow.
and through to college. And then I was in dancing, competitive dance. And so you and I have that in common that, and in some ways, I'm so appreciative because I really learned from all of that, that how important physical activity is for us as humans with our human nervous system. We need some physical activity, but we also, if we do too much, then that can become a stress. So it's a matter of how do we find that amount that's helpful and stress reducing and not overdoing it. And at the same time, realizing that over time in history, humans have really benefited from exposure to, let's say, whether it's gymnastics or dance or music or movement or some form. There's the patterns that our bodies really benefit from being exposed to. But again, it's about how to find the right amount in the right setting for you. And then I went on to start having migraines. As I think about it, actually, the migraines pretty much started when I stopped some of the dance and gymnastics. Then I started getting the migraines, and these migraines were, I think now when I look back at it, and I realized this to some degree when I was in the midst of the migraines, I realized that the migraines was what caused me to stop. When I would get a migraine and I was in so much pain and I would even be vomiting, I couldn't do anything else.
Yeah.
So I had to set aside my to-do list and just be until the migraine ended. And in some ways, I finally realized that was my body telling me it needed a break. It needed me to do nothing but sit in bed for however many hours until it could calm down and recover from everything I was asking it to do on a usual day. And so the migraines were really a message of, hey, Doni, you need to be human and take a break for a minute. And once I really started to recognize that message and give myself those breaks before the migraine happened, then there was no longer need for the migraine, And so to realize that sometimes our bodies give us physical symptoms as a message of, hey, I'm overwhelmed in here. The hormones, the neurotransmitters, right? The vagal nerve, the adrenal system is just hitting overwhelm, because we so often expect ourselves to be basically superheroes. We're supposed to be able to do everything all the time and not need a break, and right? And eventually our bodies tell us one way or another that's not the case. We do need to give a break and have a chance to connect with ourselves.
Yeah. And that's exactly where, I can't remember if I mentioned it here, right as we were chatting right before, was that, yeah, when our body or the universe, however you want to, literally is like, no, you need to step back. And it's funny because I also liken that to weight gain, because weight is also a metaphor for protection, for shielding, for any sort of insulation. And, it's funny. I didn't always like the word weight. I didn't really want to talk about it because then there's a whole body positivity movement that, oh, we should always love ourselves. But then there's a place of, well, wait, what if we do want to lose weight? But that's also the metaphor of like, what are we willing to let go of so we can further fill that up in coming back home to ourselves? Like, because I realized there have been times that, yeah, my weight's fluctuated a little bit, but the difference now is my reaction. If I notice I'm up a few pounds, it's like, all right, let me stop and think. Okay, sure, I can go through diet, lifestyle, and all that. But on the deeper level, what were the behaviors behind it? What thoughts were coming up that maybe were triggering some of those cravings, or whether, or mindless eating, whatever it is. Yeah, same. Like I had an underlying eating disorder for probably about 15 years. And so all these different pieces of the balance really comes from within. Because yes, we could take all the supplements, we could do all the meditations, but it's like there's a moment where that flip kind of switches, where we just get it. And then it becomes practicing and staying true to that aha moment of like, oh, wait a second. I don't want to feel like this anymore. Yes, my weight may go up and down. And please, if you're female, as I joke, like with the, especially like pre-menopausal women, like we have 4 hormones in flux at any given time. Like, it's okay. Trust me. But that's also then the dedication to yourself, both in loving yourself at every step of the way. And to your point too, of just when these things do come up in psychology, we have at least 7 different defense mechanisms, which at the end of the day, our body just wants to keep us safe. So if we start to kick that sand of like, wait, where did this thought come from? Wait, why is this happening? Our body, our nervous system, our third eye, like that intuition, it's not having it.
It's going to try to stop it.
So we get those defense mechanisms. This is where we could blame others or blame something else or a situation or deflect it. Just like, no, I'm just going to put it on you instead, or just stuff it really far down. And so we have all these ways of trying to protect us. And I think that's important to note too, is that one of the hardest things is to really sit with, we may not always know what event is going to happen or predict it. And sometimes we do so-called have to learn by trial and error.
Something a lot of people don't know is that too much stress can actually create an abundance of health problems like high blood pressure, high blood sugar, anxiety, migraines, insomnia, even fertility issues. This is because high stress puts your adrenal glands on overload. They release cortisol and adrenaline, which controls your digestion, hormones, immune system, energy, focus, and even your emotional response. So how can you beat stress when you don't know where to start? That's why we have a free 7-day stress reset program. It's designed to help support weight loss, digestive healing, and hormone balancing. It includes support for integrating self-care, daily tips come to you by email and video, gluten-free, dairy-free meal plans, as well as grocery shopping lists, journal pages, and more. This free program will help you beat stress and put you on the path to wholeness in your body. Get your plan now for free at drdoni.com.
Absolutely. And it's like just being patient with yourself through that, because we sometimes think, oh, healing is right. It's supposed to be just all forward, all positive overnight or something. But really, no, it's not. It's a process where you're having to learn your body and what it needs. And that may be a process of, let me try this. Okay, try that out. Well, some of it maybe was helpful. Some of it wasn't. Let me try another thing. And it's this, right? It's this moving forward and back a little bit and forward and back a little bit. And just knowing that that's the normal and okay process. That's actually a good thing to experience. That, I love how you're saying that, the trial and error, because I think it allows us the acceptance of ourselves, and it allows us to have patience with ourselves. Because if there's that message inside you that's saying, oh, I must have done something wrong, or I'm not doing it right, or this always doesn't work for me, or these kind of messages, it just is going to set you back. And so learning to notice those messages and shift it and say, actually, I'm in a learning process. And here's the things that I have learned and that are going well. And I can keep my body's, the thing I love is when patients start to realize that their body is giving them messages. And like you point out, it's not just their body. Sometimes it's on an energetic level, or maybe coming from a spiritual guide or from some other energetic guide, but it's giving you information to help you move forward, because your healer, your naturopathic doctor, your practitioner may not have that information. It's hopefully your practitioner is helping you get in touch with your own inner guides in the process, because then really, to me, the optimal for the people I work with and the patients I have is I would love for them to learn their bodies more, learn what does their body need at this moment, and what have they learned through this process that they can keep coming back to those tools in the future as things come up. And so they become more able to understand themselves and be able to self-regulate and not be dependent on a practitioner or someone else. I mean, sometimes it's, I think you said earlier, being able to ask for help and have a guide and have someone help you, but you want to have that guide without becoming dependent on them. You want to, right? You want to learn your own way of helping yourself, but also having another person to help you when you need it.
There's that difference of like having that conversation versus a tell me what to do. I mean, I can get it, like a little bit in the beginning, but then it's also like, well, let me just make sure you understand, and all of that. What I do see too is, like the different sides of the body. Like if there's something on the left side, it's usually a divine feminine or like some kind of female, like think just female or in your family or friends or partners or anything along those lines. The right side is divine masculine. So this is where, like, if someone has any pains or cramps or, whatever it is on either side of their body, my next question is, so what's, how are you with your parents, your partner, any issue going on or issue coming up? Say we've worked a bit on the mental emotion. Oh, yeah, no, I just got in a fight. It's like, okay, you need to go and talk that out. So that's like kind of one of those little clues of, really looking at the spiritual side of things, because maybe what's happening physically isn't so much a risk factor from the physical side. As I joke, like, well, it's beyond the Merck manual, that big, thick blue book with, okay, all these physical risk factors, and here's your ICD-10 code, and here's the test that we're going to do, and then here's your drug. We are so much more than a physical body. And there's when our symptoms talk to us on that mental emotional sphere, that's one side. The other piece I like to look at too are chakras. And those are some of the deeper meanings of like, okay, where along the body are we looking at now? Hey, it's a digestion, metaphorical for, okay, what are you not digesting in life? And then where is it appearing in your life? Is there an issue at work? Like, we can go through all these topics that really there is such a beautiful alignment to just how our health is interacting with the universe.
Well, and to realize that a lot of these systems of medicine you're talking about, even say the chakra system or energetic healing, is dated way back before Western conventional medicine in pharmaceuticals and kind of our standard medical approach, which of course we need and sometimes need to access surgical care or pharmaceuticals. So we're not saying those, you don't ever need those, but we're saying, hey, sometimes it's worth looking at what else could be going on here besides just what's immediately obvious to us on a kind of what we can see or what we can understand on a 3D level. What can we want to look at it on these other levels that really came back in history, like the chakra system that you're referring to. Let's tell people a little bit more about that. It's and I'm really curious too about it, because it's looking at these energetic places in the body. But what we also, if we think about it, they also coincide with our autonomic nervous system and the interconnectedness of the different systems in our body, which when you're going to different specialists in the medical field, it can seem like our body's supposed to be a bunch of different parts, right? There's the digestion, and then there's the nervous system, and then there's the hormones, and then there's the skin, and then there's the ovaries and uterus. It's like all separateness, but actually really our bodies are not separate at all. It's all interconnected. All the nervous system is communicating with the immune system and and the hormones and so it's like we just really need to understand there's all this interconnectedness. And that's one thing about, say, the chakras and understanding the autonomic nervous system, is to really realize that it's an interconnected system, and it's complex, and yet not overwhelmingly complex. Sometimes when we understand the complexity, it actually becomes more simple in some way, right? Like,
it's so funny as you say this, because yes, as much as oh my God, I feed off of just studying all the ancient medicine. I mean, even Hippocrates knew astrology and astronomy and philosophy. Like, doctors thousands of years ago were freaking brilliant. From the math to the philosophy. And then I'm thinking, wait, we just go to medical school and learn science. I mean, I know that's a very reductionistic, but it just made me.
They had so much more knowledge. They had
and the way they synthesize it to understand the body. Or actually, it was back in college when I did a summer in Ecuador, and I was going around with the shaman, and it's like, even there, where yes, they take ayahuasca to be a healing modality and just see, okay, what's really going on with the person. But it's saying, oh, you have vivid dreams, you're hearing voices. All right, great. Let's explore more of that.
Mm-hmm.
Even to the place of, like, when we were talking a bit with the emotions, if we're having those huge emotional breakdowns, chances are there was either a generational issue that you're breaking, or something around your past lives where, like, when it's that pronounced. So it's another way of saying, hey, it's not just you, especially in this society where, okay, like, put your emotions to the side, or like, don't really bother people with it.
Mm-hmm.
So I guess circling back into the chakra system. So we have the 7 energetic centers. We also have, from the base of our spine to the top of our head, then one right above our head and one right below that base. Mm-hmm. Then we also have energy centers throughout our body. So there's the main 7, then there's at least 113. Ancient India, it's kind of coming from there, these ancient systems. But what's correlating, and they have found science where there's actually literal energy type centers where, if they're off, they can manifest in physical dis-ease. They are correlated with mental, emotional, and then of course spiritual reasons as well. But the funny thing is, it's not just one chakra being out of balance, like what you were saying, or not just one organ. You're looking at the whole system, how things are lining up, how things are working together. So it's real. It's like a confirmation, I find, in many ways.
Yeah, usually
when people are asking that why. So I'm like, I was always after that why too. So yeah, here's just another, like, no, okay, we need to focus on this too.
Yeah, it's almost like a relief to have sometimes to realize, our bodies are interconnected, and these systems of medicine from other parts of the world and other parts of history can really teach us aspects, like being able to integrate that in and to recognize it. And one of my favorites of the chakras to talk about is the heart chakra, because it's so, it's so interesting to think about that. We know the vagal nerve, right? The vagal nerve is the longest nerve, and it actually connects. It's what communicates this parasympathetic and sympathetic nervous system. So whether we're in that fight, flight, and survival mode, or we're in this like rest and digest and heal and recover mode, and the vagal nerve communicates with the digestion. So we hear about it a lot with the digestion, but it also communicates with the heart. And what we call the heart also makes a hormone called oxytocin, which is the hormone of love and bonding. And isn't that so amazing to realize that we use even the symbol, the emoji of a heart is communicating love, like the hormone oxytocin, but it also comes from our heart, which is our heartbeat and our heart at our heart chakra. And so when we have sometimes on an energetic or spiritual, emotional level, struggles with love and connection, it can be stemming from that chakra needing attention, needing more coherence. What we call coherence, right? Coherence is, think of it like a nice balanced signal. Something like if you hear a sound that's very nice and balanced, or you see a wave that's nice and coherent, that's what our bodies and our nervous systems respond best to. When something's incoherent, it would be kind of jagged, and it makes really jagged shapes and jagged experiences, and that would be incoherent. And so a lot of times what we're doing when we recognize or we realize that there's issues on any of these chakra systems, for example, it's about how do we create more coherence? How do we help that energy center function in a more balanced way? And it actually creates more coherent energy signals, and we can actually measure it, for example, with like heart rate variability, right?
Or the heart math.
Yeah, we can actually see these patterns of coherence, or sometimes I love this that I've seen sometimes with meditation, where you can actually see more visual coherence, or they can definitely measure coherence in the heart rate. And it's just amazing, right? We start to go, oh my gosh, these things are not by accident. And it really can start to teach us that as we're just human, first of all, we're humans living on Earth, and we have this nervous system and amazing bodies, but our bodies are responsive to our environment, but also our bodies need us to provide them the opportunity to rebalance and be coherent in all these different areas. Otherwise, that's when different health issues develop. So it's like just realizing what does our body need in order to help maintain that balance and health.
Yeah, and as you say that, what came up was it's that shift, because it's that competitive athlete, or the competition in general. What it takes to even shift from comparing yourself to others, comparing yourself to how you were, just everything on that side. To say, wait a second, what if that's not meant for my body? And it's not good or bad. It's just not. And realizing that you are in this physical vessel. Okay. So then what do I need to nourish it? Not compared to someone else, not compared to the stuff I grew up with, but in the present, and having that view of health is just so different than what we were taught, conditioned, even more than the quick fix, which I remember the moment I found out about naturopathic medicine when I was 19, the first words out of my mouth were, I got to tell everyone there's no magic pill. I just knew like there was just more, because there's so much. And isn't that fun too, to know that there's so much that we can nourish ourselves with, instead of just, okay, this one thing, and attention diverts somewhere else. So
yeah, because it's like we then we're so detached from our body and our experience, right? Like so often to kind of live in as you were kind of saying earlier, live in our mind, or live in this abstract world where we do a lot of stuff, but really we're not in connection with, kind of my head is connected to my body, and my body is giving signals to my back and forth to my head or my nervous system. And to just then go, oh my gosh, wow, I'm an interconnected being in this interconnected space with other humans and other living things. And it's a whole different awareness for ourselves and our lives. And I think in some ways, it can also help us to be more accepting of life and death, right? Because otherwise, we're constantly in this fear state of fear of death, or fear of what happens after death. And when we can be more present in our lives and with ourselves, then that means we're going to be more present with whatever experience happens next, whether that's death and whatever happens after that.
Yeah, and that's exactly why my logo now is the Phoenix Rising.
Ooh, awesome.
Yep. So what was happening was when I was practicing in New York City for, say, probably, yeah, for about 6.5 years, I was branded as weight and hormones. It's how I branded myself. It's how everyone knew me. But I also knew that we were always more than our diagnosis.
Mm.
And as we talk a lot about emotions, I began realizing, of course, first with myself and then, as people would share or with patients, whomever, was that we all get these aha moments, but it's how we respond. Sometimes we push them to the side if we may not be ready to deal with them, or just if we don't even see it. And that's okay. That could be someone's life path. But then there's others who may look at a moment, and it was a few years ago when I started having a number of these. I'm like, wait a second, why is this happening? Why do I feel like I need to be serving more and on a deeper level? Because I also couldn't have had all these conversations that we're having, say back when I was preceptoring you, or even, not too long ago, so to speak. But it was realizing that we have ego deaths. And with that, it's also, yes, then coming into the physical death. But at the same time, when we're at that place, no one's really griping about their health. Everyone just wants to know that they made someone happy in the world and they did some good. And isn't what we want for ourselves. So these are like these ego deaths, letting us know that we're safe. And then step by step, it's like, oh, then when you're coming into the physical, this is where we read so much, I believe, about people saying, I'm ready to go. They're just comfortable with it. It's okay.
They found peace with their process and with basically like, here's what's in this present moment. I'm not, it's so much a time we're either living in the sort of the future, anxiety about the future, or living in the past and, depression or negativity about the past. But how do we get into that present moment and go, whatever it is, it's okay. And I can get through it, and I'm loved and protected just because I am.
And even that statement in and of itself, and then that too, it kind of transcends what it means to, even the meaning of like health and disease, rather than where I've seen where you could take disease and hyphenate it. Like, no, actually like ease, but it's just like you're just like off to the side, kind of to get you back on track, so to speak. So it really, I think this redefining, especially what health, wellness, life purpose, is that too innately lowers the stress response.
It really does. I don't know if you know this, but I just recently went to Peru, and I spent a couple weeks in Peru, and working with a shaman similar to what you described.
Oh, great.
Yeah, and it really, what I really was so impressed by too was to learn a lot about Incan culture. And the Incans, not only did they also study astrology, but they really were focused on understanding self and purpose and connection in the universe. And that to me was really powerful to understand that that's what they were thinking about and striving for, the Incans. And, that's what can be a real lesson to us now, is like, how can we come back to that self-awareness and feeling that we understand ourselves and our purpose and our connection with others and in the universe. Pretty powerful.
Oh, definitely. And it's funny. Yeah. So when I was in Ecuador as well, I remember like going to their pharmacy and it was all natural medicine. You pretty much had to pull so-called teeth from a baby to like even find an over-the-counter. And it's
all herbs and teas and as medicine. Yes.
Yeah. And imagine having bugs at their farmer's market. That's the whole story.
Not just because they were there, but because you could actually use them as food. Yeah.
Oh yeah, great protein. We had some indigenous meals there. But No, but it's true. It's like that said, and that's where I was like, oh my God, to be able to explore and to realize like, yeah, we were put on this earth. Earth gives us what we need.
Mhm.
And it's like as we connect to ourselves, then as others help reflect, okay, like where are we in the world? But then on the larger scale, there's nature and the universe. And yeah, and how important that is. Like I said, at the end of the day, we all just want to know that we made some sort of difference in the world.
Oh my gosh, thank you so much, Serena. This has really been a
Yeah.
joy to talk with you. How can people, I'm going to put in the notes, but if you don't mind just
Okay.
sharing, how can people find you and get in touch with you if they'd like to just find out more and perhaps work with you to help on some of these levels?
Of course. Say the easiest way to reach me is my website. So that's drserenagoldstein.com. I do offer complimentary 20-minute phone calls. You have my social media there. So that's a really easy way, just kind of your one-stop shop.
Oh, very good. Very
Yeah.
good. Thank you so much. Oh my gosh, I miss getting to connect with you. So we should stay in touch more.
Yes,
And,
definitely. I know I would say I've loved seeing you on social media as well. I know we both do a lot there, and it was like mine. So this was just an easy.
oh, good. I'm so glad. I'm glad, and thank you for sharing. I think this really will be helpful for people who are, especially who may be feeling like they're struggling on their path to wellness and maybe just opening up some other little possibilities or thoughts or potential areas to explore that maybe you hadn't explored before, and to know that it's not strange. This is something that many people also have, over not only now but back in time, have explored these different ways of understanding ourselves and looking at things, because it there's a good reason. It can really bring a lot of insight and shifts on, sometimes it's a level that other people can't even see. It's this internal shift within you, just based on understanding yourself and your purpose in life better. All of a sudden little shifts start happening, and it's so exciting, right?
It is.
So to be able to help people do that is, I know it's rewarding for me, and I'm sure it's rewarding for you too.
Yeah.
Mm.
To be able, that was a great summary. And that's where I was thinking too of like, you can always question, if something doesn't feel right, it's not you, just find the right person
Mm-hmm.
or go within, ask yourself,
There you go. Yeah,
right?
there you go. Go within and go to your, whatever, because I think sometimes people don't really realize they can have it may be even a spiritual guide. Maybe it's someone who's been important to you in your life, who maybe even it has passed on, isn't here anymore, or however your religion might be, could help you to connect on that level of just understanding. Or like you and I think you and I have in common that we like to travel and connect with other people around the world, because sometimes that helps us to just ignite that inner wisdom. But you can do it from home too, right? You can do it from even
Of course.
listening to music, or just even being quiet. Being in silence is sometimes the best way to listen within.
Yeah. Yeah. From the silence to the music, or sometimes I'll share, like, go to your hobbies. Sometimes that's pretty telling. It's really like whenever you can get lost in the moment.
Mm.
That's going to be pretty telling. It's like, okay, go find your zone. And then if there was no judgment, what comes up? And which is another big, like, how can we say whatever we need to ourselves without censoring it?
Oh, I love that. What a great message for ending with, is just set aside the judgment, have that unconditional acceptance, and then see what comes to you. Love it.
Yes. Yes.
All right. Well, thank you again, and we'll talk more soon.
Yes, that would be great.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.